Physical therapy student struggling with learning pharmacology, all the medications, all the adverse effects, this is for you. So, four strategies here. The first one is memory palace, and I have an example of this coming up. It's basically you have that whole list of all the medications. If you're able to associate it with a picture or even a crazy story that you're able to come up with, that's really going to help you retain the material better. And this works across the board in all classes in PT school, not just pharmacology. The second one, and second and third really, is called the Venn diagram strategy. This is when you, and I have an example of this too, where you group the signs and symptoms. A lot of students tell me that it's hard to remember everything, all the adverse effects, they all kind of get jumbled together. But really, if you're able to group the signs and symptoms that are similar and differentiate what's unique, that'll help you really retain everything and keep everything organized as best as you can. So with grouping the signs and symptoms, maybe you have a list of all the medications, and then you are able to control F and kind of see what's similar, what's different, and really picking up on the patterns with that. And then also what's unique. So you can kind of tell what's unique when it's the only adverse effect of all the other medications. And then the fourth one is really just visualizing the patient population who are using these medications and making it salient. So this is an example of the memory palace. So this is what I use to study for the boards and also for school. So really just kind of keeping everything organized and then just having mental pictures of what the medications were. So for example, with muscle relaxers, not even going to try to pronounce these, but just having this scene from Drake and Josh is really what helped me memorize it. And you can do this however, whatever is going to help you remember it is really what's best. And then this is the Venn diagram strategy, just comparing and contrasting the medications. So gabapentin and carbidopa-levodopa both have the sign and symptom of dizziness, but what's unique to gabapentin is it treats nerve pain, and then carbidopa-levodopa is for the Parkinson's symptoms, and a unique adverse effect is dyskinesia. So hopefully these strategies help just learn pharmacology a little easier and make it a little less stressful and a little easier to retain all the info.